Okay, this is a video for a Foley catheter insertion, which we've all done many times. Just doing a video on it so you guys can watch it and get yourself checked off on skills. Okay, so we're gonna start opening it. And you have your patient positioned correctly, you know, bed up if you're taller, like me, so you don't bend over and hurt your back. Light right open, bright light on, sheet uncovered, things like that, explaining the purpose to the patient. This you can use as a garbage bag. So let's talk about these things on top that we normally just dump in the garbage. So it has directions for use, which we all know. This you can also give to the patient in case they want to read about it. That's nothing. This is a sticker. It goes on the outside of the bag, which we'll talk about, but it says like date, placement, time, who placed it, all that stuff, reasoning, department. So this should go out, the stickers like this should go on the outside of the bag. They're stickers. Okay, and then this, so you have normal gloves on, like the normal blue gloves. This is for cleaning the area. So I'm not gonna open this, but you open this, there's like the cleaning towelettes. So with your blue gloves on, you know, you're doing your wipes, same as where you would do your iodine. Just clean off the cleaning towelettes. And then this is a hand sanitizer. You snap it in the back, and then you can clean off your hands. Okay, then you're gonna open this up. So it's over here, orient towards their stick. So place tray like this. I'll just open it. Okay, you're opening your tray sterilely. Here's your gloves. So you're gonna put on your sterile gloves, depending if you want to use these or just the normal pack of gloves that we use. I'm not gonna put them on for this purpose. And then everything here for sterile. So you have this drape. This one goes underneath there, but it's kind of nice because then you don't get iodine all over the pad and like wonder if it's like maculator. And it just expands your sterile field. So you place that under their butt. This one, which I know is not everyone uses, but this is like a window to the vagina, and again it expands the sterile field. So if you like bump something, your hand or something, it just makes sure everything is sterile. So that would go like that. I'm just gonna lay this over here to stay. And then you have your iodine or chlorhexidine if they have a shellfish allergy or an iodine allergy. You put the iodine all over your sticks. I'm not gonna do that. Your 10 cc syringe of saline you're gonna attach to your right here. This is your lube. So what you're gonna do is spray a whole line in the dispense thing, not just a glob of it, because they're saying they want you to dip the catheter in it like this rather than like dunk, because it says like the lube can like clog up the catheter. So you wanna not dunk it in and then clog it up, because that's what the urine has to go through. You're gonna spray your line here, toss, lay this in here so the whole thing gets lubed up. Get this all out so it's not twisty-turvy. Okay, now you're ready to do your thing with the patient. You're gonna position yourself. I'm right-handed, so I'm over here with my left hand, spreading the labia. Now you do your sticks, your three, so you go on that one furthest away from you first, and then inside, and then straight down the middle, way down, and then you're ready. This is with the blue obviously off, but then you can place that in. Once you see urine return in the tube, then you keep going a couple more inches, and once you're in there, then this is here, but you inflate your balloon on here, and then you're good to go. That's in. Clean up all this stuff. Put this on the edge of the bed, and then we'll talk about the stat lock. So you have your stat lock. So what you want to do is you want to clip, well, okay, so there's this cleaning and like sticky stuff. It's like a wet pad. So you pick a spot on there. You're gonna do the top of their thigh. You're not gonna do the inside of their thigh, because if they're like laying on their side, it's like a skin integrity risk, because that is kind of like a hard plastic to be in between their thighs. So you're doing the top of the thigh, kind of higher up, and then just keep an eye on your stat lock, because as they're moving patients and doing position changes, like with peanut ball, their legs to be open, or like with running man position. And I've seen where like the catheter is like stretched so tight because it's on the stat lock. So just keep an eye on it. You might have to like unclip from the stat lock for different positions so it's not pulling and injuring your urethra. You just want to keep an eye on it basically. So you do this sticky stuff on their leg, you wait for it to dry, you kind of touch it and it'll be like sticky, and then you're ready. You clip in your catheter there, and then you can stick that on their leg and it'll be nice and sticky, and then you can hang this on the bed. So what you're looking for is not to have any like dependent loops. Like you don't want this to be all like this because urine won't go through it. You don't want any kinks. You want it to be like stuck in the crack of the bed because the bottom of the bed goes off for labor. And this is hanging off. And so then we have our Foley care wipes. So when you first insert the insertion, that's the first like catheter care. But then every 12 hours you have to use these wipes. These are in the triangle. Comes with 5 wipes. You should only use 1 pack per time you use it, even if you don't use all 5 wipes. But it says in here all the steps of you using Foley care on both their vagina and the catheter tube. And then it has this orange little sticker. So the orange sticker goes on the outside of the bag, so twice a day. So if you do it one day, the way that you do it, you put the sticker right here, and then night shift will do it there, day, night, day, night. So just kind of, that's a way to keep track of it, is if you've done it. And then charting wise, you know, in the catheter, it's important to write the reason for using it. Like you can write like bed rest with epidural, or accurate INO for MEG, or like preterm labor bed rest, or whatever you want to write a reasoning for it. And then make sure you're using, there's like securement method. You want to write that you're using the stat lock. And then just emptying it every so often. You don't want it to get too full. You want to keep or check on it with position changes, making sure it's still draining. If it's kinked, you know, it won't empty the bladder. And that's about it. So sign there's a competency form. Make sure you sign that, write your name, fill it out, that you did this. There's mannequin to practice on, and then you're checked off.